to shift our attention and shift how we fight for Medicare. We are a fabulously wealthy country. We have a strong sense of community and are committed to equality. We have the wealth to do it. In a democracy, we get to decide. Thank you.
In a nutshell, what I'm looking at is first of all this issue around population aging. The notion that we're sitting on this demographic time bomb, that healthcare expenditures are already out of control and they're commanding an ever greater share of our budget, and as soon as the baby boom generation retires en masse, then game over, folks. That's it. And I'd have to say that several years ago I found that argument somewhat compelling. And it wasn't really till I started diving into the numbers myself that I've become convinced that the population aging is actually not a huge bogeyman in terms of the future of healthcare. I think we can find ways of managing it. And the experience of healthcare is that in the areas that are covered by public health insurance, hospitals and doctors, that's where we see costs contained. It's in all of the areas that aren't covered by a public system where you've seen the massive escalation. And Colleen talked about that in the context of private insurance. This is the demographic challenge, okay? The dark diamonds are our children. The kind of grayish squares are seniors, and then the total of those two are the white triangles. And what these are called dependency ratios. So that is the proportion of an age group, children or seniors, relative to the sort of working age population. The total population between ages 18 and 64. So the idea is to give you a sense of the relative proportions. So we all know this is true. The proportion of seniors relative to the overall population is rising over time. But what you often don't hear is that the share of children in the population is declining. So there may be upward pressure to some extent in terms of healthcare costs, because those are predominantly incurred by seniors, but that'll be offset by a reduction in the amount that we need to spend educating and caring for children. So what we need to look at is the sum of those two elements together. And it's true that these are expected to rise up by 2031. And 2031 is basically what the demographers estimate to be the peak in Canada. That's when the share of seniors relative to the population will be at its maximum. After 2031, it starts to decline a little bit. So to the extent that there is a demographic problem or challenge, we build up to a peak and then it starts to dissipate. So the notion that it's not manageable, I don't think is really on. And furthermore, if you look at the sum of children and seniors together, you find that even though it's rising after 2010 or so, even at the peak in 2031, it's still lower than it was in the early 1970s. So it's not like we haven't been there before in terms of the population that needs to be serviced through the taxes largely paid by the working age population. We live in a world of growth. The economy's growing, prices are going up, all of that kind of stuff. And you can basically break healthcare costs down into four main things. One is inflation. This is just the price of purchasing healthcare services, the annual increase it costs to have doctors and nurses on staff, the cost of buying your supplies, and all that type of stuff. Inflation in terms of the cost of providing the same amount of healthcare services. Second thing is population growth. The amount by which the population grows over time. If you double the population, you're going to double your total amount of healthcare expenditures. Pretty straightforward. The third is population aging, this thing I mentioned before. And the fourth one is what is, it's a bit of an awkward term, but they call it enrichment. That is the notion of the expansion of healthcare services. So part of the reason why healthcare costs have increased over 30 years is that we actually provide a lot more healthcare services than we did in 1975. Now, there, in terms of the criticisms of healthcare, obviously we could do more, we could do better, but the notion that we have more home care, we have more long-term care facilities than we did in 1975. Now those have been declining under the current government, but I'm talking about the big sweep of history in terms of the package of healthcare services that everyone gets as part of the public system. So I've just plotted the first three, population growth, inflation, and population aging on this. I put them as an index, so it's basically trying to show the broad percentage change over time. So the biggest single cost driver in the healthcare system is just inflation, the notion that we have to pay more for doctors' salaries and nurses and that type of stuff. Population growth is a bigger factor, and population aging is a cost driver, but it's a relatively small one. In fact, it's of the four I mentioned, it is the single smallest one, the one that you have to actually worry the least about. I took a few different scenarios. I looked at the demographic projections that BC Stats does in terms of what we expect for population growth, what we expect for population aging. I took a sort of 10-year estimate of what inflation in the healthcare system has been, and I projected that forward to 2031. And then So what happens when you do that is that the total amount of healthcare dollars by 2031 will be about triple what it is today. Now, if I wanted to paint a really scary picture, I would just leave it at that. Oh my God, healthcare scores are going to triple, run for the hills. It would be the Carol Taylor trick. But the fact of the matter is that the economy is going to grow over this time as well. The proper benchmark in terms of future healthcare affordability is what share of our total income are we spending on healthcare, and that total income share, and I would add the caveat that this is a measure that has its problems, but the general one we use is GDP. So if you look at a medium growth scenario, which is the black in the middle, which is a 5% growth per year, which is about in line with the rates of economic growth we've seen going back to 1991. So remember the horrible economy and the terrible NDP years and all of that. Average rate of economic growth in those years, and this is in nominal terms, is about 5% per year. Well, if we have that, then the share of healthcare expenditures relative to GDP actually will fall from its current level of 7% to just over 6%. So basically, under the implication you can take from this, under the medium or the high growth scenario, is that we actually have room to expand the suite of healthcare services that we're providing. We could expand the amount of pharmaceutical coverage. We could bring in dental coverage into the public healthcare system. We can contemplate actually expanding that. Thanks very much. I hope you found that interesting.